Good morning. I'm Dr. Manoj Sahu. I'm the Senior Consultant and HOD Psychiatrist in Tata Main Hospital. Today I'll be talking about a important childhood developmental disorder that is called ADHD. ADHD normally we call Attention Deficit Hyperactive Disorder. Normally that manifests these children, they manifest when they start going to either into preschool or schools. Typically the parents are referred by the schools or the teachers that you go and visit uh, psychiatrist or psychologist is the child is not sitting quietly in the class. They are disturbing others, they are destroying the atmosphere of the class, they're inattentive, they are over talkative, and normal the complaint is that as a class teacher it is difficult to manage that child. So the parents come to us and they tell that, doctor, you see, our child, we can manage at our home, but he is not manageable, or she is not manageable at the school. Typically, this can be a part of the normal developmental process. But when we call the child is having ADHD, it is very important. We should differentiate between the normal developmental hyperactivity from a attention deficit hyperactive disorder. Typically, what happens in ADHD, uh, the hyperactivity or the inattention or the over talkativeness or the impulsiveness or the disturbing others or the difficult part from the teachers to manage the children in the classroom, typically it should manifest at the home also, it should manifest in the play area also, and in fact it should manifest in the clinic where I am seeing the child also. Typically the child does not sit in a place, he is fidgety, he disturb others, he destroys the things around, or he makes the things disarray around what is arrange things in the environment. And of course, when you engage the child with certain things, the child will not engage, and you'll distract and see here and there, and shift from one activity to other activity. And it will be really little bit difficult for the clinician or teacher or mother or parents to engage with the children. So, what is the problem we face in managing the ADHD children? So, first and foremost thing is it is difficult for the parents to accept that the child has a problem, and they have apprehension. Once you go to a doctor, they will write medications, and that will detrimentally affect the developmental of the child. So, out of fear, either they don't come or they go to a person who has less experience about the disease or disorder, and they land up in problem which manifest in the adulthood in form of either the child has anxiety problem, or the child become a personality problem in terms of conduct symptoms, or child has academic difficulties, or child has substance abuse. So if you don't treat ADHD in childhood, they can land up in all these problems I described in the adulthood also. So it is foremost thing to educate the parents what is ADHD is, and definitely with the treatment, mostly the treatment we offer in ADHD is first to differentiate between whether it is a normal developmental disorder, or in terms of mental retardation or autism or ADHD, or it is a normal developmental hyperactivity. So first we differentiate between other developmental disorder and ADHD, because ADHD normally has good prognosis, good treatment outcome than other developmental disorder like mental retardation and uh, autism. So in ADHD, typically we treat them with behavior therapy. Parental counseling and guidance is very important. Normally we teach the parents that you should brought up the child in a positive environment, identify the positive aspect of the child, and better you focus on the positive aspect rather than always focusing on the negative aspect of the child, which will detrimentally affect the growth and development of the child in terms of his healthy personality. Second thing, we teach the parents and the children about several attention enhancing exercise, which is very time time consuming process, and it gives results over a period of time. The parents expect that they have come to us, I'll teach exercise and they will have result in a couple of days, or but normally it takes weeks to months. So if the parents persist with the treatment, definitely they will get results. Third thing, we advise to the parents to do a ABC analysis about the problem behavior they face in the either school or in the home environment, so that we educate them how to manage those behavioral problem, and how to manage, how to reward them, how to manage the consequences of any problem behavior in terms of either through the behavioral analysis or through either reward, or sometimes we remove the reward which already the child is getting in terms of lot of reinforcements. And medication is a very key aspect of the management of ADHD, but unfortunately lot of parents have apprehensions about them using medications in children. So we don't normally jump to writing medications in ADHD children, but in fact after behavioral interventions and all these things, if you don't get result, definitely we can write medication, and these are safe medication. Particularly these are the medication which is designed to give to the children, so that will not have any detrimental effect on the growth of the brain of the child. So this is my submission to all the parents who have children who suffers from attention deficit hyperactive disorder. Don't panic, seek help. Definitely your child will have a better future. Thank you.